Joining me is the member of NTAGI as well as the chairman of the working group, Dr. NK Arora. Very significant milestone yet again for the government, as vaccination for 12 to 14-year-olds will now begin from 16th March. Sir, how long were the deliberations, and what message do you want to send out to all those from 12 to 14 years who were still not included in the vaccination drive in India?
Thank you very much, Milan, for inviting me. So this is another milestone. As of yesterday, India has already administered 180 crore doses so far, and almost all our adults have received at least one dose. And more than 80% adults have received two doses. And 15 to 18-year-old children, 75% have received at least one dose. So the whole purpose and objective is that we provide a protective cover to our population. And I think that may be a very important reason that Omicron came like a tsunami, but it has also subsided and did not really cause concern across the country. So now 12 to 14, 15 years old will also be getting vaccination from tomorrow onwards. Here, I would like to emphasize that children below 18 years generally do not have serious COVID infection, require hospitalization or death. But almost 3 months ago, or more than 3 months ago, the technical group had advised that children with comorbidities should be offered vaccine because, as compared to their peer age group, the risk of severe COVID, hospitalization, and death increases by 5 to 7 times. And
Right.
therefore, the children in that age group who have these comorbidities like obesity, diabetes, neurological disorders, chronic heart disease, chronic lung disease, liver disease. So, and those having cancers and on immunosuppressed, they need to be given this vaccine protection. Unfortunately, from a program perspective, it becomes very challenging both for the parents as well as program how to identify and ensure that all of these. And that was the reason that yesterday all above 60 years have been now asked to take the vaccine because of the same reason. 15 to 18 years also similar reason.
Right.
And now 12 to 15 years, so that these all those children who have comorbidities also benefit. Here, I would also like to emphasize that 10 to 15% of children below 18 years have some kind of comorbidities which increase their risk. And therefore, it is important that we protect our this population. And that's the reason that 12 to 15 year will also get the vaccination. Another very important reason is that events happening in last few days. We have seen that suddenly China, there is a spurt of cases, even in Hong Kong and Singapore. So we are keeping a close eye on whatever is happening in other parts of the globe. We are hearing about something like Delta Cron or some new variants may be coming up. Our own surveillance is very, very closely being monitored. But all in all, the purpose is that a layer of protection should be provided to all the vulnerable population. And as part of that, 12 to 14-year-old children are also being immunized now.
So, having said that, the 12 to 14-year-olds will only have Corbevax in the government's vaccine basket at this moment. Why is that? And when will we see the Corbevax data for safety and efficacy? Because ultimately, it's a question of vaccinating children from 12 to 14 years.
So, two parts you asked. One is the why only Corbevax? Because this is the other vaccine which is available for children at the moment. Zycovir D has not been used in adults, so still we are not able to use that. Corbevax is a vaccine prepared on a very common platform, which is called protein subunit vaccine. And hepatitis B, which is there for almost over 4 decades. It's a very safe vaccine platform. and protein. And the data we have seen in adults as well as in children. And adult data is showing that the immune response is very good, and it fulfills the regulator's requirement. And even in children, the immune response is excellent, as well as safety profile is also very good. There are hardly any local reactions of fever or any serious events. And so, all in all, it's a very safe vaccine and immunogenic vaccine. Efficacy today for any vaccine cannot be expected because large sample size for doing comparative trial with no vaccine on one limb and the vaccine on the other limb is unethical. So bridging trial or immunogenicity trials are done these days once the primary vaccine. So this vaccine is very safe for children as well as immune response is also excellent.
Hmm. So, and about when will the data be made public so that people are also assured of the safety of the vaccine?
So, as I understand, the company is in the process of publishing that data. It is their responsibility, and we hope that they publish as soon as possible so that it is available in public domain. But regulators as well as the NTAGI working group has looked at that data.
That's a welcome news. In fact, we also heard that some members of the NTAGI said that they did not recommend going below the age of 15 years to vaccinate children. What would you say to that, sir?
No, I see. In general, the working group has said that children with comorbidities have to be immunized, and that was
Mm-hmm.
about 3 or more than 3 months ago. And
Okay.
there are programmatic imperatives. How do I find a child who has got chronic liver disease, chronic heart disease? Parents themselves are not aware, and different parts of the what kind of certification will be required. So it makes the delivery of the program challenging, and that's the reason that the vaccination is being done in a wide manner. It is also aligns with WHO's SAGE policy, where they say that if adequate amount of vaccine is available, adults have been immunized, then children can also be immunized. And taking all this, it is not talking about children without. It is important to understand children with morbidity have to be covered, and this is one of the strategies to cover them adequately.
Hmm. Hmm. So, while that being very important because children at this moment were not part of the vaccination ambit for COVID, what are your analysis saying about the next wave or the next variant that we could see? There was a study from IIT Kanpur. Has that been looked at by the government saying that in July we'll look at perhaps the next wave of COVID-19 in India?
So I think there has been a response from ICMR. There are issues with that modeling exercise. Modeling is exercise are important tools, but they need to be peer reviewed. But
Hmm.
overall, we cannot let our guard down. I just mentioned that recent days there has been sudden spurt of cases in China. In Hong
Hmm.
Kong, there have been cases. There are even I would say North America has suffered more because of during the Omicron epidemic than the previous Delta epidemic. So
Right.
we cannot let our guard down, but it will be really difficult at this time to say when will be the next wave. And here
Hmm.
another issue we are hearing about something called Delta Cron, which is a
Yeah.
recombinant between Delta virus and Omicron. What is its
Hmm.
behavior? And even there are Omicron sublineages like BA 2.2. How are this
Hmm.
going to behave? So we have to be very vigilant because complacency when we have about 2000 cases, bringing complacency is not a great idea, and therefore we should continue to keep the guard and keep our population well immunized and protected.
Absolutely, sir. And that's why my other question to you would be a lot of people after 60, from the age of 45 to 60, want to know when they will get their booster dose in India.
I think we should wait for some time and see as the things unfold. Uh, uh, we will come to know more. There has to be some discussion on that issue.
Hmm. But so, do you think, in the light of recent events where China is also looking at a spurt in cases in Vietnam and Hong Kong, does India still require to give booster to its other age groups as well?
We are doing a very close surveillance, genomic surveillance, and I wonder whether you are aware that within next 1 or 2 weeks we will be starting sewage surveillance for genomic for identifying the circulating virus and also any new variants come. So all these things have to be looked at in a comprehensive manner for any further decisions.
Hmm. Well, for now, only Corbevax will be given to 12 to 14 years, and Covaxin is already being given to 14 to 18 years or 17 years of children. 18 and above vaccinations have happened. In India has already administered a record number of more than 180 crore doses in the country, which is an achievement because people have accepted vaccination. But this time it's for children who were left out of the ambit, and now the Indian government has included them. Starting 16 March, they will get vaccinated with Corbevax. Dr. NK Arora, thank you so much for joining us on India Today.
Thank you very much.